Hey everyone, this is Dr. Tiffany of TMD Collective. And as we approach this holiday season, I wanted to do a really unique version of the show. Today, we're not talking about myofunctional therapy or TMJ. We're talking with an expert dentist. His name is Dr. David Rice, and he is a renowned figure in the world of dentistry. You may know him from The Doctors or as the founder of the nation's largest community for new dentists and students, Ignite DDS. Dr. Rice is not just a leader, but a visionary, connecting today's young dentist with the future of dental practices. He's also the chief editor of Dentistry IQ, and he leads a thriving practice in East Amherst, New York. With a wealth of experience spanning over 28 years, including training at prestigious institutions, Dr. Rice brings a unique perspective to our conversation. And actually, we go all over the place with a range of topics from the evolution of dental education to challenges that new dentists face and much more. Before we start, a quick reminder, if you find value in our show, please consider supporting the podcast. Your donations help us bring valuable content to our dental community. Now, let's welcome Dr. David Rice and explore the dynamic world of dentistry. Quick legal disclaimer, all information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. Hey everybody, this is Dr. Tiffany with TMD Collective. I'm so excited today. I have a very special guest, Dr. David Rice of Ignite DDS. I've been following him for a while. He's got this incredible business, like 40,000 dentists strong, which I just said to him ahead of time, I have basically 800 followers on Instagram and you have 15,000. So I'm a little behind you, but Dr. David Rice, thank you so much for being on the show. I'm really excited to have you.
Thanks for having me. It's great to be here.
So my show is a lot about airway, TMJ, myofunctional therapy. I was a PT before I was a dentist. And so I'm really passionate about looking at things through a bigger lens. Some people say like, oh, you're the mandible dentist. And I'm like, no, it's not just about the jaw joints. It's the big picture. But I really wanted to talk to you about kind of like the business side of it, because for me, I've been trying to build a niche TMJ only practice and struggling to be fee for service to bridge the gap. TMJ kind of falls between like medicine and dentistry. It's not really well covered. It tends to be like way on the spectrum of either like Gwyneth Paltrow, you're like rubbing essential oils on your jaw joints, or, more evidence-based dentistry. So I try to keep tabs on, what Gwyneth is doing. We're the same age. She's rich and famous and I'm neither. But tell us a little bit about your journey. Like, how did you get to be like Ignite DDS?
Sure. Gosh. So 29 years in dentistry. Love it. I've always been a teacher at heart. So I used to, back in the day, teach part-time at Buffalo's dental school. As much as I love patient care, is some of the best stuff I'd ever done. So I thought, boy, wouldn't it be cool to teach people all over the place? Like, why just in New York? So we kind of grew a, small community in Buffalo, couple hundred people, and then a couple hundred led to 1,000. And then I just asked everybody who's in our community, I'm like, God, you've got to know dentists and students other places. If this is valuable, would you tell them? And then one day woke up, I'm like, holy cow, there's all these people and everybody really needs help and wants help. So it's the coolest part of what I get to wake up and do professionally every day, is just work with young dentists predominantly, and then dental students. And then one day, like all the old gray-haired people like me woke up and said, oh, Ignite DDS, that's where all the young people hang out. So now we kind of bridge that gap and connect different people together pretty much across the US, Canada, a little bit Europe, but it's mainly North America.
And did the pandemic shift a lot of that for like all of the like digital stuff, or were you guys kind of already like established with all of that?
It's a great question. So I would never wish a pandemic on anyone, but we were so built for the digital age already that we hyperdrived when the pandemic hit. So we probably grew maybe 30, 40% in those 2 years in all aspects. Our community, the education we provided, the folks we connected with on the industry side, it just really, it fast tracked all the things that we had. So for us, it was a really good example of when you build, the right people, the right process, and have a solid production model, like how it can all come together. And sometimes it takes like a weirdo event like that in life for it really to start to shine, but it helped us, if anything.
Yeah. Yeah.
Weird, I
Are you
know.
seeing that like the education, what people want is different than it was 15 years ago?
Yeah, I mean, think about 15 years ago, 10 years ago, trade shows were pretty popular. And,
Mhm.
whether it was Chicago or CDA or Yankee Hinman, any of the, the kind of the more notable ones, that's where everybody wanted to be. And some of it was education and some of it was community. And I think today, younger dentists don't need that community at all for lots of reasons. Some of it just generationally, that community happens socially online. Some of it because of the drive for the new graduate to go into a group setting. So a lot of the relationships are formed in the group itself. So today, to me, what I see winning big are niched meetings and
Mhm.
hybrid meetings where people do, they come together for a day or maybe 2 days, but a lot of the rest of the learning happens digitally. And that like kind of combination works really, really well right now.
And are you seeing that like they want also to kind of have more of that retreat model where maybe they're having those lectures during the day, but then they go out wine tasting or, go to like a Pilates class or do like a fun run or, something where like you're building some of that self-care or, kind of fun things in with it as well?
100%. I think, in some way, events have always been about who creates the greatest experience. But to your point, I feel today that experience is a smaller one where there's a lot more one-on-one attention and we actually get to know each other and we can talk about things that you could never talk about if there were 500 people in a room or 20,000 people at a meeting. It like we get lost in those things. In fact, I did a 2.5 day at Panky. I do that twice a year, every year with them. They're phenomenal. And what you shared is their exact setup and kind of cool because they've done that for 30, 40 years where you learn by day, small group. There's never more than like 25 dentists in their courses. And then you have these evening sessions, and it's really when people get to know each other and people get pretty vulnerable and they share really cool things. And as a result, I think they learn so much more and they feel much more connected to the other people who are there as well as, the host, which is kind of
Right.
cool.
Well, and I think the days of like, people want also like accessibility to mentors as well. I think about kind of some of the mentors that I had in my dental experience were the ones that were like so generous with their time and their knowledge and, didn't make you feel like inferior or stupid for asking a question. But, I think people really want to get into like the nitty gritty of how do I run my practice or how do I manage my team or, some of the real world stuff that maybe, up on the stage is like looking really spectacular with these big cases. But then you're like, wait a minute, get back Monday morning and like stuff's broken. How do I fix what's broken? Yeah. Yeah.
100%.
Well,
Yeah. And you're right. We can be honest with each other in small groups. I can share here's all the stuff I did wrong. Go
yeah.
make some new mistakes, but don't make the same ones I made, and
Right.
those are great. Those are things that people really want to know and want. Like nobody wants to go to a course and see, perfect pictures of perfect cases. It's easy to cherry pick those and make it look really like nothing's wrong in the world, but that's not reality.
Yeah. Well, and I think as a leader too, people kind of want you to be vulnerable as well, I mean to realize that like the day-to-day grind is sometimes not always like fun or pretty, but if you have that support and community that you can get through it.
I think people want to see themselves in you and know that, oh my gosh, one, I'm not alone. And then two, wow, if that person can do it, I can do it too. As opposed to the old school, I think lecture was trying to show how difficult everything was to accomplish. I think the successful
Mhm.
speakers and mentors today are people who I want to I want to give you the secret sauce. Like you should know all the things and all the steps. And it doesn't need to be as difficult for you as it was for me. I think those are the folks that really resonate with today's dentist.
Well, what I'm finding in kind of the space that I'm trying to create is that I want to also reach out to a lot of like myofunctional therapists and physical therapists and speech language pathologists. There's a tremendous interest in airway and sleep dentistry, but I still think that the general dentist needs to be the one like leading the team that's driving the discussion with the craniofacial growth and development and coordinating all of the pieces of the puzzle together. I think that we're perfectly positioned to have that role.
Exactly. I mean, there's so many avenues today that people can pursue, but they need a leader. They need direction. They need a map, and they need a support structure. I was just in Hershey, PA, speaking to a group, and I met a hygienist there who now does 4 days of myofunctional and 1 day of hygiene, where it used to be all hygiene. It's grown to this place. And it was so cool talking to her, to like hear her passion, see her passion, and then hear her give credit to the dentist who really set the stage for her to be able to do all that, and how grateful she was. And now like this really incredible partnership they've developed for her business kind of
Yeah.
sprung off this original general dental practice. It's really cool when we're not so turf driven, great things happen.
Absolutely. Well, I wanted to talk a little bit. What do you think are like some of the biggest challenges for like the new dentist coming straight out of school? Because I saw Becker's Dental just came out today with like the 69 tuition of like all the dental schools. Number one was EOP, I think $101,000 a year. I mean, it's just like mind blowing. How do you get out of school? I mean, I'm still paying for my student loans. It feels like an anchor, and I've been out of practice at 16 years. And, I took time off to be a mom and, kind of like didn't practice full time. But, this like staggering amount of debt that students are faced when they come out. Like, what do you say to that?
Who I like to meet them before they grab that staggering debt. Because if I'm being 100% honest, if you walk out with $600,000 of debt and you don't own anything yet, which is typically the case, you're in trouble. And that's a sad thing for me to say out loud. So I try to catch people on the front end. I love UOP as a school, and there's some other really strong ones out there that have really high tuition. But if you're not in that school yet, don't go there. It doesn't matter how good of
I
a
went to
degree you
Loma
think you're
Linda
going
and
to
they're at like
get.
74K.
Yeah, they're not far behind. They're not far
Nope.
behind. But the reality is, I think my big message is, listen, respect your debt, but don't let it stop you from doing what you want to do. The cool thing, at least today and for the foreseeable future, is lenders don't care about your student debt. Lenders care that you and I save like $75,000. It's liquid. They're not going to even want to take it for a down payment, but they need to see that it's there and we have the ability to save. So they want to see that. They want to see our ability to go get more continuing education, and they want to see us grow in speed. And that's all they care about. So you can go out there, you can own a practice today and do quite well. You need to put 2 years in. That's about the time frame that most lenders want from us. And if you don't want to be an owner, there's plenty of opportunities out there on the associateship side where you can make, a really good living for yourself. But those loans will be an anchor for you over time, like you're mentioning. I think the debt is the biggest one, and the next big one I think is all the noise that's out there. There's so many people in a young dentist's ear and a dental student's ear telling them what they can't do, and then maybe giving them a slightly, if not very biased look at what they should do because it serves their end goals. So if I'm a young dentist, I'm saving some money early, and I'm being really, really cautious as to who I'm listening to.
Yeah, because it's easy to like want all of the toys like right away, like the cone beam CT and like the, 2 or 3 digital scanners and, the 3D printer and all of the software. And, like you see all of that in it. The trick is like, oh, that's going to make your life so much more efficient. And, but all of that stuff takes time to integrate. And then that just adds to that big dental balloon of a loan.
Yeah, it does. I think if I'm a young dentist today, what I'm focusing on is diagnosis and treatment planning. I need to be an excellent diagnostician. I need to be able to treatment plan. I need great communication so I can both lead my team and help my patients understand what you and I understand. And once that happens, you can be very productive. You can run a pretty lean machine. And then, you know what? You wake up in a couple of years and you realize like, oh, okay, this is going pretty well. Now I can make some of that tech invest and prioritize it and, pick which one first, second, third, and so on and so forth.
Hi there, I'm Dr. Tiffany Lamberton. I'm dropping in with a quick friendly note before we jump back into our podcast. Let's chat for a moment about mentorship. If you're a dental professional wrestling with TMD cases that you're really struggling to get it, I understand. The complexity of diagnosing, crafting those detailed treatment plans, and ensuring your patients are comfortable, it's a lot, isn't it? Here's the good news. You don't have to manage it alone. I'm here to offer a helping hand with my personalized one-on-one coaching and consulting services. Drawing from my rich experience in temporomandibular joint disorders, as well as my physical therapy background, I'm all about guiding you through these challenges with ease and confidence. Think of me as your personal mentor, here to bolster your TMJ management skills. Together in our sessions, we'll dive into the practical know-how I've gathered over the years. From strategies to helpful tips, I aim to streamline your practice and enhance your effectiveness. The best part, our sessions are super flexible and designed to fit right into your busy schedule. We'll focus on comprehensive learning, and that's not just about TMD, but also touches on improving patient communication and growing your practice. So no more feeling overwhelmed by TMJ patients and TMJ pain. With a bit of teamwork, you can boost your experience and confidence. Ready to take that first step? It's easy. Just swing by tmdcollective.com/VIP to book your first session with me. Let's team up to take your TMD management skills to new heights and really elevate your practice. Your path to becoming a TMD expert starts now. And now let's get back to the show. Yeah, what's on your top list for, if you could just buy anything before the end of the year for your office? What's on your radar?
Oh man, so we just got into Solea.
Laser.
So that's our big tech this year. Hard and soft tissue laser. And I have to tell you, I feel like a kid again. I'm learning. It is everything they promised it to be and more. I've been treating patients that I'm like, there's no way that I'm going to be able to work on this patient without anesthesia, that I'm going to be able to achieve it with energy with this laser and then just go to town and do these things. But I'll be darned. You sure can. It's crazy. So that's my personal tech for the year as we wind down. It's super exciting.
Nice.
You.
And then, oh man, well, my situation is different because, like I said, I'm trying to run a TMJ only practice, and I'm all about the diagnosis. I'm fee for service. So what's been really hard for me is just setting a fee for my time, because it's not just the time with the patient in the chair. It's the time afterwards, like coordinating with the sleep physician and the ENT and doing all the narrative reports. It's kind of like putting together all of the pieces with the CBCT and the sleep test and the MRI and, who do we need to kind of pull into the picture. So I've certainly struggled with, charging a full fee for my services and my time. And right now, my clinical schedule is not as busy as I would like it to be, just because I'm kind of building from the ground up. And then, the other part of it is that I'm trying to build the educational system with the podcast. And I want to have, kind of this very niche educational experience too, where people come to Seattle and, we have this incredible, the mountains and the sound, and go out on the water and have some wine and go to a Pilates class. So, I think that I'm very much about women in dentistry right now. 55% of dental school classes are women, and, we just have different needs, I think. And so going back to the tech question is, honestly, right now, I can barely pay my bills in dentistry. Yeah. And, I'm trying to offer a lot of niche services. So one of the things that I'm doing to try to help reduce my overhead is office sharing with a colleague who has some of this tech of his own and is allowing me to use it for a very small like rental fee. And that's allowing me to kind of keep my overhead low as I'm building. So I don't know,
I
maybe
love
we
it.
have to like kind of build these, centers where like we're doing like cost sharing because a lot of this stuff is very expensive. All the toys.
Totally. Absolutely. Yeah, they're not giving it away, it turns out, huh?
Turns out they're not. Yeah. And I
Yeah.
mean, the other thing is like you could have the best podcast in the world. It doesn't mean that like anybody wants to like support it either. So,
Yeah.
you
No, I
know,
mean, yeah, true story. It's a lot of downloads before somebody wants to help you there.
yeah, exactly. You gotta hit that like 15,000 mark or I don't even know what it is, but yeah, no, I'm so passionate about, the fact that TMJ, like 10 million people worldwide have it, twice as many women than men. Why have we been kind of ignoring it from the dental perspective? Like you said, we're stronger when we work together in interdisciplinary teams, but we need to learn how we can integrate and do and share that load for the benefit of our patients. So, I think it's exciting with interceptive ortho and how we can start to look at our patients in a different way. So it's like that young female, like the 10 to 12-year-old, maybe we can catch her pre ortho or kind of like before she goes down kind of a route of dysfunction and pain and limited range of motion. How can we intervene? That's really where like TMD Collective got started, was just that passion for finding that patient early rather than late. So, because I have a lot of like
Yeah.
37-year-old females in my dental chair that are crying and they're in a lot of pain.
It's a bad place to be for people, and I think if the world understood that, how it's dissimilar, but how akin it is to like chronic back pain, like once you have it, oh my gosh, it's a thing.
Right.
So if we can get in there
Manage
from a
it.
prevention standpoint, do all the things to not get to that bad place, patients are in such better shape.
Well, and dentistry alone is like very difficult on our musculoskeletal systems too. So we've got to figure out
Yes,
a
it
way
is.
to keep our bodies healthy as we do our profession. Have you found like
I
yoga or Pilates or like physical therapy to be helpful for you in your career?
I found a few things. So, like almost like more of a meditative yoga where you're not doing a lot of postures, but you're doing less over 90 minutes and holding them has been really helpful. And I have a patient who's also a trainer, owns his own gym. And when you meet the right person, they have the right personality. They push you enough to keep you
Mhm.
going, but they don't push you so hard that you decide you don't want to do it anymore. And Brett, I remember the first time I walked into Brett's gym, and like all gyms, he's got like floor to ceiling window or mirrors everywhere. So he makes me stand in front of the mirror and then turn for like a profile. And he's like, look at yourself. You're broken. You know how long, but he was like the right guy in the right day with the right sense of humor. And he, pushed me to really do things. So there's, things that I do when I'm at the gym, and then there are exercises. He's like, just do these things like in between patients if you have a minute or 2 minutes.
Mhm.
It took you a long time to get your body to bend in the wrong way. So it's going to take a long time to get it back, but we can train those muscles to pull in the other direction over time. And even like little things like, you know, uh, hold your toothbrush and your comb with your opposite hand to just get your body used to balance and doing those things, which feels incredibly awkward at the beginning, but it's amazing. Like all those things add up and have helped me over the last, God, probably like 7, 8 years.
Is he one of those trainers that is like, oh, you have like one hip that's higher than the other, and then like you're pronated with this foot, and like, does he look at like all of the kind of like systemic issues, flexibility, range of
Uh,
motion?
yes.
Yes.
Yes. The level of pain I'm in on stretching with him is comical at some point, because if I'm not laughing, I'm just going to weep
You're gonna cry.
from the pain.
Right.
Yeah, but yeah, he's very comprehensive, and he's also a great example of what we were talking about earlier, talking out loud to other professionals and sharing like, hey, this is my purview, but I want you to go see this person too, and they're going to help you with these things. So I love that because it's a mindset I've had in our practice. So it's nice when you meet somebody who isn't afraid to lose you as a patient, just as really truly looking out for your best interest.
Well, I'm like a big devotee of Pilates. I feel like I hope I can do that until like I'm 90 years old because it's all about the breathing, the spinal articulation, all of those like small movements that, learning how to kind of control your body and muscle contraction, I think is super essential to, just the longevity of our field and our career. So I think people want to feel good, right?
Totally.
Yeah.
Yeah. Yeah. And turns out if we don't go to work, we don't get paid. So we have to stay healthy.
Haven't figured out how to make money just like sitting out on the boat with like, where it's just like cha-ching, cha-ching. Or maybe you have. I don't
Yeah.
know.
A little bit with digital education, but the reality is as dentists, we sort of get paid to perform and do our thing.
Well, is your private practice, is that what subsidizes the educational part of it, or does the educational part like live and breathe on its own terms?
Thankfully, today, the education is really the dominant revenue stream for me. So in the beginning, it was all my practice, and everything I did on the education side really was a bonus because I had the practice. But about 9, 10 years ago, I made a vision shift and said, okay, where do I want to be? And part of my vision was to have total mobility. It went from all practice, little, almost no education, to today. It really is almost all education. And I go back home to New York from Florida every other month to do practice for a chunk at a time. So it's way more education today than it is practice. I do enough practice to stay like relevant with technology, with material science and leading a team. And then I take all that and bring it to the education side.
Were you really careful, like who you chose, as like if you accepted any type of like sponsorships, or if you're going to be advocating for, let's say, a certain type of technology? What due diligence did you do on that end of it?
Yeah, super question. Because I think a lot of people aren't careful today. They're so hungry to get somebody to give them any kind of money at all. I was very careful. I'm still very, very careful. In the beginning, I literally only worked with people that I already had a 10-year or more history with. So
Nice.
when you looked at technology, it was with companies that I'd done business with as a dentist for a very long time. And now we vet companies, we pull their technology in, we use it, we test drive it, we make sure we love it, we make sure we're going to integrate it ourselves, whether it's myself at my practice and my team, or if it's one of the other young dentists who's on Ignite DDS's team. Sometimes we'll integrate the technology in their practice, and then they come back with a report and say like thumbs up or thumbs down. So we're really, really careful and selective. And if somebody doesn't, then if they don't live up to who they promise to be, we just say, you know what, you're great, we love you, we just can't do business with you moving forward.
You guys use a cloud-based software?
We use EagleSoft's version of cloud. I've been a Patterson guy for 30 years, crazy as that sounds. So we do. How about you?
I've been using Curve Dental for about 2
Yeah,
years.
Curve's a good,
Yeah.
that's a good program. Do you like it?
I do. I feel
Yeah.
like they've had good support. They're a little pricey, especially with my tight budget. To me, it's worth it for the customer service.
Sure. Yeah. I know some people from their team, Mark Blount, a really good guy. I know him from the industry. So, but yeah, we went from, when I first bought my practice, we had Dentrix, and then we grew too big at the time. Dentrix really didn't have like an enterprise level. So it became a problem. We shifted to EagleSoft. And then when Fuse came out, which is basically EagleSoft in the cloud, we made that move. The cloud helps today. There's talk about costs, right? IT costs can get super expensive too.
Yeah. And just like the fact that you can just like take your laptop, you can be on the dock at the lake and you can look up a patient. If you have a, another provider calling for information, you can just log in from wherever you are. That's really cool.
Yeah, very
Yeah.
helpful.
I wanted to get your take on, there's a lot of, so in my state, Washington State, we're getting another dental school. Obviously, we have UW, which is like a powerhouse, but there's another dental school coming in here. They're going to be based in Yakima, Washington, which is kind of the eastern part of the state, and they're going to be kind of working out of like FQHC, and then they're also going to have a branch here in Tacoma, which is my town. So I'm really, interested in looking at that. I just saw that they took a $12 million grant from Delta Dental. So I know that Delta Dental, it's like can kind of
Yeah.
like raise some hackles. Well, what's your hot take on that?
First, we don't need more dental schools. It's terrible that we keep opening dental schools. We need more hygiene schools, that's for sure, but we don't need more dental schools. But dental education has become big business. It's the only reason schools are opening up. They're leveraging data to say, oh, there's going to be a shortage of dentists in the next 10 years. And the answer to that is no, there's not. There's going to be a shortage in the areas where there have always been shortages. And you could open up 1,000 dental schools and still you and I are never going to practice in those locations unless there's an incentive to be there. So I don't know. I don't like it. And then do I love that, Delta Dental is going to be the big backer behind it? Not really. I mean, for me, I would say take that money and give it back to the people who work with you as providers rather than try to build your brand further and pretend that you're giving back and you're wonderful humans. You're not. So that's about as honest spicy as I can get. I don't like schools opening up, and I don't like insurance companies, or quite frankly, I don't like any big groups running dental schools. It's a conflict of interest. So it doesn't make a big group bad, or it doesn't make a certain insurance company evil, but it just means there's a conflict of interest. There's no question about it. And there's a lot of money there. So that's why it's allowed.
And I know that a part of what you do with Ignite DDS is, there's a lot of, kids that are coming out of dental school that are going to work for some of these big DSOs. And, you're kind of encouraging them like, okay, it's time for you to, step outside of that. What would you say to the young dentist that says like, I don't feel like I have a choice. Like these are the only jobs that are out there, or Gentle Dental or Pacific Dental Services, or, Aspen Dental, or yeah.
Sure. Yeah. First, I would say you always have a choice. And there are a lot of practices out there looking for you if you take the time to look for them. Now, does that mean you're going to have to get paid a little bit less for your first 2 years? Yes, it does mean that. You're going to give up money for added mentorship if you make that shift. So I would say sit back and assess what you think is best for you. And listen, I totally understand. Not all DSOs are bad. Some of them do a pretty good job at what they do. And statistically, if I'm a young dentist, if you feel like the best fit is going to a big group, do it. Just make sure you read the contract, make sure you understand the contract, and make sure when you read all the bonuses and the benefits that say at year 3, at year 4, and at year 5, all these wonderful things happen. Make sure you know the data, which is statistically, you'll be gone from that group by then, which is why all those things kick in when they kick in. So if you feel like it's the best thing for you and you understand all those things, then go for it, right? Go do it, go do your thing. And it's not my right or position to like judge you or tell you not to do it, but what I would share is don't do something because you feel like it's your only option, because that's a half truth. And unfortunately, most times half truths, you and I get the wrong half, because there's, again, a lot of people with power and money who have the ability to come and influence you at your dental school. So, just pay attention to what's out there.
Yeah, absolutely. I want
Yeah.
to hear like who you think is killing it on social media. Like which accounts, like what are your 3 favorite accounts to follow in the dental Instagram space? Come on, dish.
All right. Let's see. Who do I really like? Nate Lawson. Huge fan of Nate Lawson. He's a materials dentist out of UAB. He's part of Dental Tubules. I love their accounts so much because one, they get social media, so it's cool. And two, they bring real information. It's not BS. So
Mm.
I love it for that. Who else do I love? I like Pam Ragliano Munoz a lot. She's a prosthodontist out of Salem, Mass. She also happens to be chief editor at Dental Economics. She's a rock
Mhm.
star. Same to me persona, like tons of integrity. What she says is truth. Her dentistry's amazing.
I
So
just
that's
listened to her
great. And God,
on the Dinks podcast.
you did? Yeah.
I just,
Oh
yeah,
yeah. Yeah.
yeah. Jeff
I'll
Horowitz.
tell you, one of the biggest things I'm honored to do is be on, she and I co-host a podcast together. And when people approached us to do that together, I was like, heck yes, I'm totally doing that. She's great. And who else? Ooh, gosh, names are escaping me, but I don't know. It wouldn't be who you'd think. For me, it's not about the numbers so much as it is the people doing really good things. So now I got to pull it up. Darn, let's see. You know who's really good is a guy out of a little town in Pennsylvania called Zach Sisler,
Okay, I'll have to look that up.
and he does super cool dentistry. He learned a lot of his photography from Adamo, which I think is really cool. So again, a good example of people traveling in circles. But Zach is just he's a really strong dentist, and he's a really great person. And you feel through his channel that for him, it's about dentistry, but it's about balance with family. And he loves his wife and he loves his kids, and like that comes through,
All
and
like
he
shines through.
prioritizes and creates balance. And yeah, those are the things that are attractive to me. Those are I'm going to pick those as my favorites today. And I'm probably going to get in trouble because I know there's going to be people listening. They're like, what do you mean? We forgot about my
You're
channel.
like,
And
what
like,
about
I'm
me? What
sorry
about
in
my
advance.
leg?
Yeah.
You'll get some
I'm really
mammal.
sorry. There's lots of good ones out there, but there's also lots of bad ones out there.
Lots
Photoshop.
of bad
Pam and I had a
information
guest on, Peter Auster. Bad information, photoshopped work, and just
too. Ooh,
horrible advice. So yeah, not a fan.
same
Overtreatment.
way.
A lot of overtreatment happens in LA and Manhattan. Everybody
Yeah.
gets full mouth rehab and 28
Everybody
porcelain
wants
teeth.
super
Not a
white.
fan.
Yeah.
And teeth that I look at, I'm like, wow, with some ortho, some whitening, and maybe some zero prep veneers on some teeth, okay. But if you're putting 28 ceramic restorations on a 35-year-old, you're doing something wrong. Sorry. Yeah,
And to me
you're
too, it's
doing something
also like
wrong.
the facial aesthetics too. Like let's dissolve some of the lip filler and you know let's get to where like what
Yeah.
people actually look like.
We've
But
lost sight of that, haven't we?
it can. I blame the Kardashians. I'm not a fan. Throw some shade to the
Think
Kardashians real
about
quick.
that.
Yeah, yeah. I mean, I
They really
remember.
created a lot of
I was
havoc, those
I was
Kardashians.
in LA, when like Ryan Seacrest was like talking to her on his show about her tape in the beginning. I mean, I've been following her career from the beginning. So, I don't know. I just think like people start to look like aliens instead of like real humans. Or you see them like all filtered and then you see them in real life and you're like, "Oh, you don't look the same." They're so
For
distorted
sure.
by
Yeah, and
filters.
that's the hard part, right? Because I think people have unrealistic expectations of how they should look as people, but then I think in the dental industry, people have unrealistic expectations of how things can be made to be looked because it's easy to manipulate photos. It's one of the reasons I really like, like the prosthodontic journals and the pros meetings in places like Panky and Koi. It's like when I go to Panky, I have to prove that all my images are raw images, that they've not been touched. It has to come right from my camera to them where they can see that and it's noted. And that to me is a better sign that somebody knows what they're doing. And to your point of Adamo earlier and Amanda C is like their work's really, really good. And it is indeed their work. So that's kind of cool.
Well, I think that's the authenticity is very important. Absolutely, for sure. I just appreciate you being on the podcast so much. Like tell people where they can find you. Tell us like what you've got that's coming down, in the next couple months that you're excited about, any events that you're doing.
Yeah.
Give a shout out to your
Sure.
organization and what you're doing.
Okay, cool. So easy way to reach me is if you're on Instagram, just go to @IgniteDDS and shoot a DM. I'm on there all the time. I also have a personal channel over there. It's smaller because I wrote a book. So I launched a new channel for that book, Is Everyone Smiling But You? So you can check that out. It's actually going so well, which is kind of fun. Lots of dentists have bought it and read it, and people are sending messages all the time. So that's really cool. But the easiest place to find me is there. My email is my name. It's david.rice@ignitedds.com. I'm going to be, I'm not sure when this is getting released, but I'm headed to Northern California this week. Next week, I'll be in Southern California. And then the last big city I'll be in is New York City, around the greater New York. So if you happen to be in New York City, Ignite's hosting an event, please reach out to me because we've got like 60 spots. So if anybody here who's watching, listening is going to happen to be in the neighborhood for that, let me know. I'll make sure I can get you in.
Amazing, amazing. We'll put all that stuff in the show notes. And thank you so much again for being on my little
Sure.
podcast, for the encouragement. I think it's just great to like connect with other dentists. And, if you come to Seattle, come visit in the summer. We'll take you wake surfing out on the lake. Come in like July or August. It's beautiful today in October, but, we're headed for like months of like rain and, and gloom. But come out here in the summer and we'll show you a good time here in the Seattle Tacoma area.
Awesome. I'd love to. Thanks for having me.
What an amazing conversation with Dr. David Rice. Thank you so much, Dr. Rice, for being on the show. I know that as a new dentist starting out a niche practice, I had so many questions, and you helped really touch on some of those and really help keep our profession pushing forward. So huge thank you to Dr. Rice for sharing your insights and your experiences. For those wanting to connect more, please check out Ignite DDS and follow Dr. Rice's journey on Instagram and his work with Dentistry IQ. We'll be sure to put all of that information in the show notes. And to our listeners, thank you so much for tuning in. Your support means the world to us. If you'd like to contribute, please consider donating to the podcast. Check the link in the show notes. Every little bit helps us bring more inspiring content your way. Until next time, stay humble and stay curious, and happy holidays.